Hello, everyone. I'm Jeffrey Walt, Editor-in-Chief of Retail Media IQ. Welcome to our video forum. Today, we're thrilled to have as our guest Angie Nelson, Senior Vice President of Pharmacy at Hy-Vee. Angie, great to have you with us.
Thank you for the invite.
The pharmacy industry is in a time of transition, I think you would agree. And you recently served as chairman of the NACDS Regional Chain Conference. Maybe you could start by telling us what sort of challenges and opportunities were top of mind for people at the conference.
Yes, thank you. It was an honor to serve as the chair, and I would say at top of mind at the NACDS Regional Chain Conference was really just that pharmacies across the United States continue to fight reduced drug reimbursement, which makes it challenging to remain profitable in the pharmacy business and ultimately poses a threat to healthcare access. We talked a lot about the changing political landscape, and we also discussed the many opportunities. You know, pharmacy is poised to provide essential health care services beyond just dispensing prescriptions. You know, we can provide vaccines, we serve rural and underserved areas, and we just, utilize the pandemic and really embrace opportunities that came about with the pandemic as a profession, and we're well equipped to provide additional quality and value to the patients we serve.
Angie, you mentioned the political situation. Of course, we have a new administration, a new Congress. How optimistic are you and your colleagues that NACDS and other pharmacy advocates will succeed in winning PBM reform legislation and other pro-pharmacy policies?
I am extremely optimistic. The growing momentum and widespread support for these reforms indicate a promising future for pharmacy and patients alike. With bipartisan support and increasing public awareness, it's clear that the time is right for meaningful change for pharmacy.
And maybe you could talk a little bit about what Hy-Vee does in terms of advocacy for winning on some of those fronts.
Yeah, we spend a lot of effort. We have a top-notch government relations team, and so we're advocating for both PBM reform and scope of practice and various other pharmacy initiatives, both at the state and federal levels.
How is Hy-Vee, your business and your role as a healthcare provider, how are you responding to the evolving dynamics in both pharmacy and I guess the broader healthcare sector?
Yeah, we've been ultimately focused on becoming a point of care for the patients and the communities we serve. Because of our geographic footprint in the Midwest, our pharmacies are often the nearest healthcare providers in the area. So it's critical that we offer comprehensive services to improve the health outcomes of the communities we serve. So that means being a vaccination destination, making them both convenient and also accessible. So we've done things like drive-through flu shots, making it very convenient for individuals to get vaccinated so they don't have to come into the store. Our customer care center will take phone calls and schedule appointments for individuals that want an appointment but maybe are not as technologically savvy. We have an online scheduler, but we also accept walk-ins. We want to balance that with the accessibility. And we have 28 mobile health units that we take out into the communities so we can serve and provide vaccinations and other clinical services beyond our brick and mortar locations.
And how often do the mobile units circulate? If I live in a small rural town in Iowa or one of the other states where you operate, how often might I see one of those?
You know, it kind of depends, but most of our pharmacies in our communities are being served, but we serve beyond where we have a brick and mortar location, so we go out into other communities and provide services. So we really are working to get those mobilized throughout the vaccine season and beyond.
Food is medicine, obviously, is a very hot topic, and it would seem that Hy-Vee is very well positioned to make a difference in that area. Maybe you could talk a little bit about that program at Hy-Vee and also how it intersects with pharmacy and healthcare.
Yeah, we agree. As a grocer and a pharmacy provider, we think we're uniquely positioned to reach, engage, and support the patients in their health journey to better health. And so we employ our trusted clinicians, both our retail dietitians and our pharmacists, and we sell the healthy groceries. So it's the perfect intersection right there. Our program combines all of these assets into one comprehensive program that's affordable and easy. and our clinicians have the relationships with the patients and the communities they serve that have proven to be critical to patient engagement. And we also provide the accessibility to provide our patients with the continued education, encouragement, and outcomes measurement that is vital to improving their health outcomes. For Hy-Vee, I would say when it comes to food as medicine, we just focus on making the most of every encounter we have with those individuals.
Mm-hmm. And how much interaction is there between the dietitians in your store and the pharmacists?
Yeah, the dietitians are a critical part of our health team, and so we work very hard to engage with each other and refer back and forth. So often the pharmacy is the first place an individual stops, especially after a new diagnosis. And so being able to provide a referral to a dietitian and really help engage those patients and provide them with answers to questions that they are overwhelmed with is a key piece of our overall strategy.
And you alluded to this before, but you were talking about the broad range of services that Hy-Vee offers. I mean, in addition to pharmacy and OTCs and the food we talked about, you have in-store clinics, you have telehealth, all these things. How close are you to letting people in the areas you serve know that you're really a healthcare center and not just a pharmacy? I mean, pharmacy is essential, obviously, but you do all these other things as well.
Yeah, I believe in many ways for many of the areas and communities we serve, especially with our rural footprint, we already are recognized as the healthcare center by the patients we serve. And it's our passion at Hy-Vee to focus our healthcare initiatives around the pillars of what I think a neighborhood healthcare center should be. You know, amazing service, going above and beyond for our patients and providing the highest quality of care. Providing accessibility, we talked about it earlier, but finding new ways to reach those rural and underserved communities. Affordability, helping our patients, providers, payers, employers in our communities save with Hy-Vee. And also convenience, making it easy for individuals to get the care and treatment that they need. Quite honestly, being a neighborhood healthcare center ultimately fits into our company's mission of making lives easier, healthier, and happier.
One final question for you today.
Sure.
Based on everything we've talked about, how critical is Hy-Vee's contribution to alleviating these pharmacy and healthcare deserts, which seem to be proliferating in both urban and rural markets?
Yeah, I think by nature of our footprint, our locations are critical, and our unique approach to healthcare has helped us stabilize and really continue to provide those services. But it will ultimately be all of us standing together to advocate for change that will make the big difference.
Mm-hmm. Well, I know from being out and visiting Hy-Vee stores that you guys are really performing great service in your community. So thanks for sharing your insights today. Appreciate the time.
Yes, thank you for the invitation.